Hello and welcome to What's With Healthcare podcast today. We are three nurses who have a combined 90-year history of working and observing healthcare in action. We come together for every podcast and talk about a topic related to the healthcare system from our different perspectives we've had from working and experiencing it. We're here to share this knowledge and our perspectives, and we want to hear from everyone out there who's listening in. We want you to help us to learn more and grow more and talk and share. That's why we're coming to you every week. We acknowledge and pay respects to the lands and the waterways of the traditional Aboriginal families from where we're podcasting from. So those lands are the Yugara, Turrbal and Darumbal peoples, and always was and always will be Aboriginal lands. Welcome, everyone. This week we're talking around the idea of nurses eating their young. So this was a phrase that, actually a question that Meissner asked in 1986 in the first research document that we could find around, do nurses eat their young? And then why is that? And what's the experience? And since then, a lot of research, a lot of literature, a lot of questioning on this. So why do nurses eat their young? So today we're going to talk about our experiences, our personal experiences with this, and understand what is this concept of nurses eating their young, and it's a bullying process for sure, but what's going on? Why is it happening? And who's doing it? So we're all going to have a bit of a talk today about that and talk about our experiences. So it looks to be exciting. So Isabel, did you want to talk about what you'd learned first about this?
Sure. Hi, Sue, and hi, Celeste. Very nice to see you today. Well, this phenomena is something that I have certainly experienced. I've been around as a nurse for a few years now, so it is something that I have encountered myself and something that I've seen other people, being bullied as well. Mm-hmm. And this concept of, workplace bullying is not surprising because it is experienced all over the world. I have worked in different countries and I have seen bullying behavior in different places. So it is part of, the culture. It is part of, what we have to deal with when we are working at the workplace. Some research, some literature says that around 15% of employees experience bullying behavior. Yeah, and it is affecting not only the mental health. Some people also experience physical problems because of experiencing bullying.
It's a stress. Being bullied is really stressful, and it's hard to turn up every day feeling that you're just going to get hammered. So it ends up, stress turns into physical manifestations of illness. So yeah.
Absolutely. Some people develop, chronic back pain. Other people develop even depression, and some people even commit suicide. So this is not something to take lightly. For me, this is something that shouldn't be in the workplace, right? It shouldn't be there. We should take measures to combat this and not condone, bad behavior from people who are performing the bullying behavior, right?
Yeah.
And actually, if we're talking about senior nurses, eating their young, we shouldn't be doing that. We should be supporting the young, teaching them, right? And so they can learn and be good nurses and stay in the workforce for, and love the profession, right?
Oh, so agree.
Do you agree, Celeste?
Yes, wholeheartedly.
Yeah, absolutely. And well, as you, Sue, mentioned, there is a lot of research being done in this area. And one of the things that I found very interesting is that there are a few factors or categories, right, that we can talk about as to why is this happening. And one of the things that I find interesting is the personality. So sometimes, I was looking for information to see, and we were discussing before, to see who gets bullied, who is the person who gets targeted. And this is what I found, in an article written by Martinez in 2012. And yes, profiling, the kind of person, and the victim is usually a woman between 35 to 45 with high level of autonomy. They want to do the work well. So high level of conscientiousness, basically. High level of morality and respect for social norms. They are, high achievers, and they care for their self-image. Versus the person who perpetrates or, that does the bullying behavior. It says here that use manipulation, blame other people, for their mistakes, are aggressive. And aggressive can be not just physical, but also, covert behavior, covert bullying behavior. And their performance is usually just average. And so this is what I found interesting, because this is what I've seen as well in the field, working as a nurse and looking, who gets, and not only just working as a nurse, also working as a coach, because one of the things this is my area, right? I work with women who are experiencing workplace stress. And usually what I've been seeing is that these women are experiencing stress because they are being targeted from their bully, right? And the bully can be not just the boss, the bully can be your coworker. And sometimes I have found that, some people have relationships of friendship with the boss that are outside of work. And sometimes the person who is being targeted has no way to defend themselves, because all of those conversations and situations are behind the scenes, and this person has no idea what's going on until it's too late. So that is, for example, one case that I'm working with a lady who is experiencing that. And so most of the women that I've been working with, the work-related stress is because they are being bullied. Do you find that interesting, Sue?
Oh, look, and I having worked in nursing for a long time and witnessed people being bullied, have been bullied myself. And I actually won't exclude myself from knowing that I have inadvertently probably bullied others. And I know that I've probably done that because I've had a few, as I developed and evolved in nursing, I did become a leader in nursing. And I did have some staff come to me at some times going, Sue, I just got to ask, because I felt like you really bullied me yesterday and you really pushed me into doing this thing that I didn't want to do. And I just need to bring that up with you because I went home really upset last night and this is how I felt. And I went, oh my gosh, yes, I probably did really want you to do that, but I didn't realize I was being that pushy, and I'm sorry that you felt that I was bullying you. So I know that inadvertently, sometimes because of my need to get jobs done, my need to sort of be the leader, my need to do that, I have inadvertently been a bully sometimes, but luckily had teams that felt confident enough to come up and have good conversations with me and just say, Sue, this is how I felt. So
and that probably says something about your leadership style too, Sue, that means that it's maybe bullying is a looser term to use there, because it's more that you're open and they feel they can speak up to you. It is a distinguishing factor there, and it's sort of what sounds like one-off times when you're under pressure. Not that excuses it. I'm just saying.
See, and this is the thing. This is and I really like it because there's a grey area in here, I think, where sometimes we're inadvertently bullying each other, and eating each other, because we've got a lot of demands in the job we do. But I don't want to say that's the reason why it happens, because it shouldn't happen, because this is a cultural issue. And as Isabel said, when we allow it to happen, we're giving it a tick of approval.
Yes.
And that will keep that happening. And that's not okay, because that's when we lose people and people walk away from the profession. And this has got to stop.
Yeah. I'll just add that the other thing that I've seen and been experienced the discomfort of is having a boss who has, like I say, henchmen. They'll have their clinical nurses or a couple of allies that are within the staff, and often they're people who've been on the team for a very long time. They haven't moved wards, if it's a ward situation, haven't moved in that environment, and they're very comfortable where they are. And if you challenge the status quo, you will get chewed, like, unless you've got some allies yourself. If you're new to the environment, you are putting yourself under the spotlight. And that's where we need some strategies for how to manage that. It's, I'll get into my little story in a little while, and I think you'll see some parallels.
But no, Celeste, you talk about that cultural norm.
Yeah.
So the cultural norm is that you do it our way. There, it's our way. There is no highway option here.
Yes.
And you're just like, and that's the thing that, unfortunately, it's evidenced in poor leadership, because you've got leaders who are allowing this culture of group bullying to occur. And and it annoys me, because if we actually look overarchingly in our wards, and we see that there is a ward that's got a really high FTE turnover, and they can't keep their FTE, full-time equivalent. Sorry, I have a habit of lingo. That full-time equivalent of staff. Well, why is that?
Yes, it's a red flag.
Yeah, that's a red flag. And why aren't our leaders going, hey, excuse me, Celeste, I notice your ward, you can't keep your staff. What's going on there? What's going on with your culture? Is it a really horrible place to work?
Mm.
And, and as your leader, I should be able to challenge you, and you should be able to go, oh, no, they're all just soft. And I'm like, really? Are they all soft? What else is going on? Isn't that interesting? But I don't know that those conversations happen.
Yeah, it is very interesting, guys, because you just mentioned you just summarized the other two factors, because I just talked about, personalities. But then the next factor is the culture where you are working in. If you got some kind of toxicity in there, and you got no chance, right? Because if there's gossiping, if you allow that kind of, bad behavior, then that's a big factor. Yeah. So, and the other thing that you mentioned, Sue, was the communication. So if you have open lines of communications where, your team members feel comfortable to speak up, and they are not afraid of doing so, then you prevent that kind of, things happening. So you just mentioned that, and I think that was really good, because that person in that example, that person felt safe to come to you and tell you, what was going on, and that she felt that she was being bullied, but that wasn't your intention. And that's also something that we need to distinguish, because it's not like bullying. Well, in general, bullying is described as a repetitive behavior, even though that's changing now, because nowadays, from the law point of view, it can be just the one event. Just the one event can, cause a traumatic experience for someone. So, but if it is, as I said, intentional, with the intention for the person to leave the workplace, that's just pure evil, in my view.
Yes. Yeah, it is. And it's sad that someone would, it's sad, I think, when someone lacks so much insight into their behaviour that they cannot see that basically when their interactions with other people are truly having such a negative impact every day. Like, I don't know, I have this bubble world where I think everybody gets out of bed every day to do their best. And, that's my bubble head. And I know that, I just think that when you you have no insight into how you're turning up every day, it's the saddest place to be. That's just my thought.
And I'll add, sorry, Isabel.
Sorry. So let's mention something interesting last time, that awareness creates change. And that's probably something missing in the workplace.
Yeah. And I think that we need a bit of a shift in mindset across the board about how we view performance management, because it is an opportunity to gain insight, to get help, to be coached, and yet we see it as a negative, like, oh, you're on a performance plan, that's a bad thing. It's because you've got a blind spot, or, there's opportunity there to gain that insight, to learn about better ways of doing things and why you might be doing what you do, and to go forward from there. And it can be really formative for a person if we can adopt that mindset. And personal growth could really come out of it.
I don't know. Celeste, do you want to share your experience, Isabel, your experience about, how it felt for you to be bullied and what you noticed?
Sure. Yeah, I can take the stage for a minute if you like.
Do it.
So, rightio. So there's one that really stands out in my memory, and it's so clear I even remember the names of all the people who were present. And it was my first few weeks working in theatre as a new grad. So, no one knew anything about dealing with new graduates. It was all very unknown, and I was definitely the lowest rung on the ladder, and that was okay. But in theatre, you always feel a bit like you're on the stage, at least to start with, because everyone can see what you're doing at any point in time. So there's that feeling of being under the microscope quite often. So I come to work on an afternoon shift, and on the day we had a very long list. We had a great surgeon that used to come and visit. He'd be in the town in our region for just a few days, but he worked from daylight till dusk to give the care and to do the surgeries for people that needed it. So we started at 6:30 in the morning, and he'd go through till nearly 10 o'clock at night on those shifts. And so I came in at 12:30 on this day, and everyone's pretty fagged out. There's a patient on the table, and they've been going all morning, and they're pretty keen to have a break. And the anaesthetic nurse from the day shift says to me, okay, so there's half an amp of fentanyl sitting on the desk, on the bench there that he hasn't signed off on yet. He's got to sign the book for the last, this is he, the anaesthetist, for the last 2 patients. And here's the keys as she's getting them out of the pocket. And here's 5 amps of fentanyl that I got out of the cupboard before. So you're ahead. And I'm thinking, oh, hang on a minute, this is just such a red flag for me, because we'd had it drummed into us about legislation on handling Schedule 8 medications and the DDs, as we call them in the trade. And it's there for everyone's safety, patient safety, vulnerable staff members' safety. They're very closely guarded and always checked by 2 people to the bedside, checked with the patient, etc. And when you take possession of the keys, you count with the outgoing shift, so that then you can say, yes, I'm happy to take responsibility for these keys now, because I know that the count is right. But she hands me the keys and hands me the drugs and the book that's not completed and the half ampoule that's used, and says, see you later. I'll check the count with you when I get back from lunch. And saying, but wait a minute, I don't want these keys if I haven't counted. No, that's it. They're all gone out the door. So I thought, well, spotlight's on me. I'll just toe the line. And I did. But when I had an opportunity a few days later, I took it up with the nurse unit manager. And oh, man, yeah, that was interesting. So I guess as a new person, you sort of, and a young person, didn't sort of see that bigger picture of taking responsibility. I thought I was taking responsibility, speaking up to her and saying, oh, this is a problem for me. And anyway, it's the way they'd always done things. And I didn't have anything else to offer. I just thought we should just do it the right way. And then she was very quickly joined by a number of her peers from the team, who absolutely ate me without salt. And I felt totally humiliated and unable. I lost my voice completely then. I was kind of pissed off too, and that might have shown, because I'm thinking, well, fair dinkum, I can't believe this is legislation that I'm having to argue up to you. So anyway, so that was that. Yes, I was dripping a bit of blood after that encounter. And I guess my response at that time in my immaturity was to say, well, it's the culture. if I ever get put on the stand for mishandling medications, it'll be the culture of the place, and it can be shown that that's how it is, and I'm just part of that bigger picture, which is a bit of a cop-out, but it's kind of how I think a lot of people go, because I have seen this over the years repeated. So that is my initial story. And it wasn't until probably 25 years later that I felt that I could speak up to challenge it when I encountered it again in my work environment, where it was entrenched in the culture. I've got a few theories about how that happens. I don't know if anyone out there is familiar with the 4 tendencies, which
Gretchen Rubin.
So it's about how we respond to expectations, and it is just within us. We are born that way, and
it's our patterns.
It's our patterns of behaviour and responses to those around us. So I think that there's a lot who fall into the obliger category, myself included, very good at maintaining our expectations from others and meeting those expectations, but not so good at upholding our own. And so with that comes, I think there's some remnants from the handmaiden kind of old ways of female-dominated profession that is supporting a male-dominated profession, and we bend and flex and make allowances within our scope to accommodate others. So in that instance, it was we nurses just letting go of those rules in order to just keep things flowing and everyone to get their breaks, and those things were being the priority. So I'm going to leave it at that. So Isabel, what's your story?
Well, before I talk about my story, I wanted to say thank you to Celeste for sharing, hers, and for you, the viewers and listeners, you are finding the content of this video and podcast useful. Remember to like it, give it a like, and you can share and comment below. You can tell us about your story as well. We would love to hear from you. Okay, so telling you about my story. I was a new grad, and I had the brilliant idea of wanting to go and work in a PQ. And those were, very good years when I was there, because I learned so much so fast, because I sort of had to, right? And I did encounter my bully. That was my first bully. Oh my goodness. She was well known for being a bully. Everybody was terrified of her. So as soon as I got, in the unit, it was like people, told me, be careful with, her, because she's like that.
Well, Isabel, I don't want to interrupt, but I want to say that for the viewers out there, I think most of us have worked in a workplace where in our first few days we've been told, oh, now that's,
absolutely,
that's doodad over there, and doodad's probably going to have a go at you because doodad's an asshole. Sorry about language there. But
well, this is what happened to me. I was warned. I knew that at some stage I was going to have problems with this person. And, I was so young. And I wanted to learn. I was really keen to, be a good nurse. I was so in love with the profession at the time. And and then I encountered this person. And then what happened is that she sort of started to criticize everything. And because at that time, what happened is that at the place where I was working, you have your team, and you did sort of the same roster. So you had your team, and every shift you work with the same people. And she was in the team that was receiving. I mean, we were at night, she was coming during the day. So she was, taking handover from our team. And so we stick together as a team, and we sort of, the fight was with her team. If you think about this, like high school, but that's how it is. And Yeah, so every single time she would criticize. And then, one day, because this was, I was feeling angry and I was feeling sad and stressed. And even though I knew that sort of my team knew what was going on, and my supervisor and everybody knew what was going on, nobody sort of did anything, because it's like the natural process. That's what needed to happen. And that's where the toxicity of the place sometimes, plays a big role.
Yes.
And so what I did, I couldn't tolerate it anymore. So in the tea room, I said to her, you know what, I need to speak with you. And I talked to her and I said everything that I was experiencing. And I said, I feel like you're doing this and this, and, you're making me feel this way. And now I want to leave. I want to leave the unit. I don't want to do this anymore because of you, because of how you are treating me. And I don't know what happened there, because, I cried, I had to cry.
Oh,
yeah. That's a lot
you were being very brave. Yeah.
Yeah. I was young, probably naive and brave back then. So, yeah.
Vulnerable.
And, she was in her late 40s and I was in my early 20s. And I don't know whether I touched her heart or something. I don't know. Maybe she needed someone to tell her. Maybe nobody told her before. I don't know. I don't know what happened, because she was, in the PQ for forever. Yeah, and sort of I told her and she stopped. And then, but I don't really know whether she stopped because I spoke with her, or whether she stopped because I said, instead of, doing this to me, why don't you just teach me? Teach me so I can do the things the way you think I should be doing, And then I spoke with my supervisor and I swapped to her team. So I was with her for the rest of the time that I spent in the PQ. And then what happened is that because I was in the process of learning and trying to know it all, because when I got there the first day, I didn't know how to use a ventilator. I didn't know how to use a catheter. I knew nothing, right? Yeah. So I had to learn everything from the very beginning. And maybe she was right in, some of the criticism she had. But yeah, that's the thing. Instead of, criticizing me, because everybody knew that I didn't know because I was a new grad. Yeah. Instead of doing that, she should have taught me. So I moved into, her shift, her team, and then she started teaching me and she changed the behavior. And yeah, and then we had sort of kind of a, decent relationship. She invited me once to her house for Christmas. So that was so I feel like it was a good outcome, right?
Oh, definitely.
Yeah. From the beginning. Yeah. So that's my story.
Well, thanks. Well, and that's the thing. We could sit here and probably do 3 podcasts 3 weeks in a row on this topic because this is a big thing. And, and that's why I'm struggling to sort of share an experience because, and Isabel just highlighted a really good point there, raises a really good point around communication there, because in the literature, when you read on this, they talk about there's a big generational divide sometimes between our new nurses and our experienced nurses. And so there is this communication barrier and also this skill level barrier. And so what happens is that older nurse completely forgets what it is to be a young new nurse who doesn't have the actual skill set yet. They have a great amount of knowledge, but not quite the fluidity of practice. And the older nurse forgets that and just speaks down to the nurse, because also their communication has got very direct in their age as well. And so they don't have that generational balance of being able to go, I've got feelings and I want to talk about them now, because sometimes the older nurse has got a bit hardened as well. And, so there is those communication barriers. So I think that bravery point that you talked about, Isabel, there, about being brave and go, I need to tell you how I'm feeling right now because I'm feeling really vulnerable and I don't want to turn up anymore because I have to work with you, and And nobody was probably ever that brutal with her before to go, I don't want to work here anymore because you're horrible.
Mm-hmm.
You know, and so your courage was probably a big, sometimes we don't get, like that thing about insight. We can't develop insight if nobody ever gives us a good reason to have some.
Mm-hmm.
Absolutely.
You know?
Good point.
And yeah.
Maybe that's another way to look at it too. You know, again, we're denying somebody an opportunity to grow. We don't speak up to them.
That's perfect, Celeste. And maybe we reframe nurses eating their young to saying, yeah, nurses, you know what? You're going to get eaten. Let's just call it out and say it's going to happen. But as a new nurse, how about you reframe that older nurse? How about with your clever communication and your ability to be, you know, smarter, harder, faster, because basically you are, because you're newer and you're fresher. You have got the power here to reframe these folks. So how can you use clever communication to reframe someone? And I think if we empowered maybe our new nurses with that capacity to be good communicators and reframe those old stalwarts who are potentially being the bullies, wouldn't that be amazing? You know, that, you know, and I think about, oh, look, I don't know. I'm probably not going to highlight some of the stories because, you know, I mean, I almost got kicked out of nursing within 9 months of being in it because, you know, I was trained in the hospital system, and the hospital system had, I'm going to call it out, a really negative culture. Like there was toxicity personified in that space. And, you know, if they didn't like you, and this was based on the color of your hair, the color of your skin, you know, there was so many
really
factors.
Important stuff.
Yeah. You know, I mean, the last thing spoken to me at that point was, you're not the vision of what a nurse should be. Yet my nurse managers in each of the wards I had been on the probationary program with had said, oh my gosh, you are going to do great things. You are a great nurse. You have great skill. Like, your ability to communicate with patients is awesome. But it was those leaders who didn't like me. They, you know, because I kept asking why. Every time they told me to do something, I'd ask why. And apparently that was frustrating for them. So they kicked me out of the program. So do you know what I mean? Like, there's those sorts of things. And I'm not saying it's, you know, look, and from that experience, that growth that I got from that early experience as an 18-year-old really took me on a fantastic journey of going, you know, excuse me, you people who think you run things, you're not going to tell me how to be. Sorry, I'm going to go and do my own thing. And I think that was my oppositional defiant disorder coming through there. Not that I have that, but it was that sort of that part of me going, excuse me, you don't get to tell me how to be. But yeah, I just kept growing. But the great thing was, and I think what I've learned now out of all of those experiences, is how great communication just is the bridge that I've used to, you know, I've had some staff who've had some really bad behavior. I had one staff member who got given to me after being removed from 4 other environments, because instead of dealing with the staff member's behavior, they kept passing this staff member on. And so I ended up with this staff member who was terribly behaved. I could not believe her behavior. But you know what? She didn't know. So when I sat down with her for the first time and said, okay, so this is, I have to be brutal with you now because I'm performance managing you. This is a process where I will challenge you to change your behavior. You've got pretty much 3 strikes and you're out. So I will, if you, you know, we're going to have these parameters and these rules around how you interact with the others, you know, how your behavior has to be. And I'm doing that as your manager because I want to grow you to be the best version of you. And so what we did was, I explained to her some of the things she did and some of the allegations that were being pulled against her for bullying. She didn't know. She had no idea that she did this to people. She cried. She was so distraught. She was in a bad place. I did have to give her a week off after that, and I did have to get some mental health support for her because she did not realize her impact at all. No insight at all. And from that, though, can I say, grew a most beautiful staff member who, yeah, other people came across her a year later and said, oh my God, what have you done? Like, she's awesome. Like, and it was all just from, and I became her mentor as well down the track. And, I haven't connected in with her for many years now, but probably long after she left, she actually ended up with a much better job and moved away, and she grew exponentially. I was really proud of growing that human.
What a great story, Sue. The common theme here is like when we can have courageous conversations, when we can push through our own vulnerability and fear and be courageous and have those talks with people, we actually open up such opportunities for everyone. Like, it can only
exactly
it can just be such a good thing, and you don't know how far it could go.
Exactly. And she's doing great things now. Like, she's and still in nursing. And I don't think she could have stayed. I think she would have ended up having something terrible happen to her if she, and that isn't that sad.
And how many others would have left in the meantime as well?
Exactly. So it is a trauma. It's almost a trauma for the bully as much as all of the people they encounter. So there's so much going on there, isn't there? Yeah. But anyway, she ended up checking in with me many years later. Like, when she had this other really good role, she'd go, oh, Sue, I'm doing this now. Have you got any other thoughts on where I could do with this? And so she was really open to finding other ways of being. And I just, and to me, I was like the proud mother hen, like, is that a thing where you're a proud mother hen? But yeah, and I think that's probably what I've learnt over lots of years of poor behaviour.
Okay, thanks, Sue. Next, I think we're just going to wrap up now because our time is getting away. Just to recap some of our techniques for handling these situations. And so we've always talked about the importance of open communication and of having courageous conversations. And while it's easy for me to just say those words, I acknowledge that they're courageous, because courage is about feeling the fear and yet doing it anyway, pushing through the fear, because the good stuff lies on the other side of that fear. So you can't have courage without fear. And they are fruitful conversations. The final one that we didn't get to talk about is to step back and think, do I really need to have this battle? Is this somewhere that I really, really want to work, that resonates for me in every other way, and therefore I want to take up the fight? Or could I be getting the same fulfillment and enjoy the job I do somewhere else and leave this battle for others to take up? It's a good question to ask as well, and it may take less toll on yourself. So we're throwing that one out there. Now, there's a little bit else that's going on around in other countries and within Australia. So some places are, actual university programs are running like a sim or role play situation for dealing with courageous conversations and difficult encounters that students come across when they're out on prac, and so that they can work through those, which I think is a really positive idea. And yeah, it's sort of helping them to call out negative behaviour. If you're curious, you can check out, do a Google search, and that will reveal more ideas about how to manage these different situations. So back to you, Isabel.
Thank you, Celeste. If you are feeling stress, if you are being bullied and need someone to talk to, please contact us. The three of us are coaches, and we work with women who are dealing with stress and bullying and, compassion fatigue and all that kind of thing. So if you would like to talk to someone, I'm going to put contact details below in the description so you can contact us, and have a chat. We would love to hear from you and how we can help you. Also, if you like the video and the content that we just, discussed, please give it a like, and you can comment, tell us about yourself, your story, and share the content.